Mr. Smith.
Hello.
Hi, my name is Sarah Scott. I'm a second year medical student working with my attending today. Is it all right if I do your history and exam today?
Sure.
Okay. What brings you in?
I've noticed some blood in my stool.
Okay, how long has that been going on?
Noticed initially about a month ago.
Okay. Is it with every bowel movement?
Yeah, that I've noticed, yeah.
Do you have any associated pain when you go to the bathroom?
No pain that I've noticed with it. Just kind of, I can tell it kind of starts to get crampy and I know that I have to find a bathroom.
So you've been having some diarrhea as well?
Yeah, for about the past 3 days.
Okay. When you see the blood, is it bright red or dark? How would you describe it?
Looks more like a bright red.
Okay.
Yeah.
Have you recently tried anything to make the diarrhea better?
I did try some Imodium, but that didn't do anything for it.
Have there been any foods or activities that seem to make it worse?
No, pretty much like my steak and potatoes
Okay.
type of meals, that doesn't really change too much.
All right, so you haven't had any major diet changes lately?
No.
Okay. Have you been experiencing any weight loss, fatigue, weakness?
Feel exhausted all the time. Weight loss, I've probably lost probably at least 10 pounds in the last 6 months, I would say.
Is that something that you tried to do?
No, not at all.
Okay. Well, I'd like to get a little more information about your medical history, so I'm just going to go through some questions here. Do you have any drug allergies?
Not that I know
Any chronic conditions that we should be aware of?
of. No.
Any medications that you're currently taking?
I do take Tylenol occasionally if my shoulder hurts or something like that.
Okay, nothing on a daily basis?
No.
All right. How about your digestive history? Have you ever had reflux disease, hemorrhoids, anything like that?
I've had hemorrhoids. I got them fixed about 6 years ago.
All right. And I haven't had any since then?
No.
Have you ever had a colonoscopy?
No. I got a letter in the mail from my doctor the other day that I should probably start thinking about scheduling that, but
Okay.
haven't done it yet.
Yeah, definitely need to think about that. You are in the age group where we'd recommend. How about smoking cigarettes or tobacco use? Is that something that you do?
I used to smoke, but quit that 20 years ago.
Okay, great. Any other drug use?
Drink beers occasionally. Usually on weekends I'll have a few beers with sitting around the house or watching football with some friends.
Okay. Can you tell me a little bit about your family history? Are there any conditions that we need to make note of?
My brother's got some kind of intestinal thing, inflammatory intestinal thing.
Okay.
My dad died of prostate or colon cancer.
How old was he?
I want to say 85.
And how's your mom doing?
Mom's fine.
Great. Do you have any other surgeries besides the hemorrhoid resection?
No, that's it.
All right. What do you do for a living?
Mechanic.
Awesome. Are you married?
I am. Wife works in a bank. 3 kids. 2 off of college, 1 off on their own.
Okay. Do you have any hobbies that you like to do?
Love to camp in the summer. Love to fish all year round.
Okay. You said you've been feeling fatigued. Is that affecting your work and your hobbies?
Yeah, I feel lately just been feeling exhausted at work. Wife and I would normally like to take walks at night, but kind of stopped doing that because I just get so tired that I can barely get around the block.
Well, I'm sorry to hear that. I've just got a few more questions, then we'll get to the physical exam.
Okay.
Have you been having any respiratory issues, asthma, cough, pneumonia?
No,
Okay. Any recent infections that you're aware of? Hoarseness in the throat, swollen glands?
no,
All right. Any chest pain, murmurs, palpitations, heart problems?
no,
Okay. So you've been seeing some bright red blood, diarrhea for a few days now, but you have not been experiencing any other digestive symptoms like heartburn or nausea, correct?
no.
Okay. Well, we can go ahead and start the physical exam, so I'll have you hop up on the table.
Okay.
I'd like to listen to your lungs. Is it all right if I pull your gown down
Sure.
just a little bit? You can just breathe normally. Okay, have you take some deep breaths in and out. All right. Your lungs sound clear. Next, I'd like to listen to your heart. You can go ahead and lay back on the table and I'll do an abdominal exam. It's alright if I pull your gown up from the bottom here? Alright. I'm gonna listen for some bowel sounds. Alright, I'm going to help you press in a little bit with my hands. If you feel any tenderness or pain, just let me know, okay?
It's a little tender there.
A little down on the bottom,
There.
all the way across?
Across the bottom, yeah.
Okay, I'm just gonna do it one more time.
Yeah, same.
Okay, all along the bottom there. It's good. I would also like to do a rectal exam if that's okay.
Okay.
Alright. You can go ahead and sit up. looks like we have the results for that.
Okay.
They did find a little bit of blood in the stool, which we suspected, and no tenderness, no masses, but there was some skin tags from previous hemorrhoids, which again is not a huge surprise.
Okay.
You can go ahead and have a seat back in the chair and we'll talk about the exam
Okay,
findings.
thank you.